What is sleep apnea by Mary Copeland? Sleep apnea is a sleep disorder characterized by repeated pauses in breathing or shallow breaths during sleep. These pauses can last for a few seconds to even minutes and may occur multiple times throughout the night. The most common type of sleep apnea is called obstructive sleep apnea, OSA, which is caused by a blockage of the airway, usually when the soft tissue at the back of the throat collapses and closes during sleep. Symptoms of sleep apnea may include loud and chronic snoring, episodes in which you stop breathing during sleep, breathing cessation, which may be witnessed by a bed partner, gasping for or choking sensations during sleep, excessive daytime sleepiness known as hypersomnia, awakening with a dry mouth, morning headaches, difficulty concentrating and irritability, frequent awakenings during the night, and trouble staying asleep, known as insomnia. What is sleep apnea usually caused by? Anything that could narrow your airway, such as obesity, large tonsils, or changes in your hormone levels, can increase your risk for obstructive sleep apnea. Central sleep apnea happens when your brain does not send the signals needed to breathe. Body weight and weight loss. Excess body weight is undoubtedly a risk factor for obstructive sleep apnea. However, it does not mean the skinny will not develop this condition. Thin people might develop OSA without the element of body weight playing a role. Weight loss of just 10 to 15% can reduce the severity of OSA by 50% in moderately obese patients. Unfortunately, while weight loss can provide meaningful improvements in OSA, it usually does not lead to a complete cure, and many sleep apnea patients need additional therapies. How can I tell if someone has sleep apnea? Not all snorers have apnea, but the two often go hand in hand. As snoring gets louder, chances of having sleep apnea are greater and greater. If you have apnea, your bed partner might notice that the snores are punctuated by pauses in breathing. Those are apnea episodes, and they can recur hundreds of times a night. It's important to note that not everyone who snores has sleep apnea. At what age do people get sleep apnea? Anyone at any age can have obstructive sleep apnea, but it's most common in middle-aged and older adults. Only about 2% of children have obstructive sleep apnea. It's also more common in men than in women. Can certain foods cause sleep apnea? Dairy products that are high in fat can increase your mucus production, which can make your breathing problems associated with sleep apnea even worse. For this reason, avoid frequently consuming whole milk, cream, and certain high-fat cheeses, such as cheddar and Swiss. On the other hand, the foods that help with sleep apnea are fruits and vegetables. Those that are high in antioxidants like vitamin C and vitamin E can be especially helpful. Whole grains are good too. They are rich in fiber, which is satiating and may help with weight loss. Are there tests for sleep apnea? Tests to detect sleep apnea include nocturnal polysomnography. During this test, you're hooked up to equipment that monitors your heart, lung, and brain activity, breathing patterns, arm and leg movements, and blood oxygen levels while you sleep. You can test yourself for sleep apnea. At-home sleep apnea testing is an easy, cost-effective way to figure out whether you're having trouble breathing. A home sleep apnea test is a very simplified breathing monitor that tracks your breathing, oxygen levels, and breathing effort while worn. What is the best sleeping position if you have sleep apnea? Side sleeping is better for reducing sleep apnea than back sleeping. Research shows that in many cases, sleeping on your side can significantly reduce breathing disruptions. What if sleep apnea is not treated? Several studies have shown an association between sleep apnea and problems like type 2 diabetes, strokes, heart attacks, and even a shortened lifespan. One common problem you may not be aware of is sudden cardiac arrest. When you have obstructive sleep apnea, not only are you likely to wake up with a headache and fall asleep during the day, but you're also at risk of dying suddenly. For most patients, sudden death is not caused by a heart attack, but by abnormal heart rhythms. Sleep apnea is diagnosed when you stop breathing for 10 seconds or longer, at least 5 times an hour during sleep. Researchers suspect sleep apnea causes abnormal heart rhythms, which lead to sudden cardiac death for a number of reasons. Treatment options for sleep apnea depend on the severity and type of the condition. Lifestyle changes. In mild cases, lifestyle modifications such as weight loss, avoiding alcohol and sedatives before bedtime, and changing sleep position may be beneficial. Continuous positive airway pressure, CPAP. CPAP is a common and effective treatment for moderate to severe obstructive sleep apnea. It involves wearing a mask over your nose or nose and mouth while sleeping. The CPAP machine delivers a constant and gentle flow of air to keep your airways open. Bi-level positive airway pressure, BiPAP. This machine works similarly to CPAP, but adjusts the air pressure during inhalation and exhalation, which may be helpful for some individuals who have difficulty exhaling against the constant pressure of a CPAP. Oral appliances. These devices are designed to keep the airway open by repositioning the jaw and tongue during sleep. They are most suitable for mild to moderate sleep apnea or for those who cannot tolerate CPAP. Surgery. In some cases, surgery may be recommended to remove excess tissue or correct structural issues that contribute to sleep apnea. Positional therapy. This involves using devices or techniques to encourage sleeping in a specific position that helps keep the airway open. Whether or not you should use a CPAP machine depends on your specific condition and the recommendation of a healthcare professional. If you suspect you have sleep apnea or are experiencing symptoms like loud snoring and daytime sleepiness, it's essential to undergo a sleep study and consult a sleep specialist. They can diagnose the condition and suggest the most appropriate treatment for your individual needs. If prescribed, CPAP therapy, consistent use can significantly improve sleep quality, reduce symptoms, and enhance overall health and well-being.